Hello, I'm Dr. Sugar, your internet doctor, here to continue our discussion on esophageal cancer. I would like to discuss my recommendations for lowering your risks of developing esophageal cancer. So if you're ready, let's get started with a dose of medical inspiration. According to the National Cancer Institute, a division of the National Institutes of Health, or the NIH, doctors really cannot always explain why one person gets cancer and another does not. I love their explanation. Scientists have studied general patterns of cancer in the population to learn what things are around us and what things we do in our lives may increase our chances of developing cancer. So anything that increases a person's chance of developing a disease is called a risk factor. And anything that decreases a person's chance of developing a disease is called a protective factor. So we'd really like to limit our risk factors and increase our protective factors. Some of the risk factors for cancer can be avoided, but many cannot. For example, although you can choose to quit smoking, you cannot choose which genes you have inherited from your parents. Both smoking and inheriting specific genes could be considered risk factors for certain kinds of cancer, but only smoking can be avoided. So prevention means avoiding the risk factors and increasing the protective factors that can be controlled so that chances of developing cancer decreases. Although many risk factors can be avoided, it is important to keep in mind that avoiding risk factors does not guarantee that you will not get cancer. Also, most people with a particular risk factor for cancer do not actually get the disease. Some people are more sensitive than others to factors that can cause cancer. So talk to your doctor about methods of preventing cancer that might be effective for you. There are some risk factors and preventive factors that may affect whether a person develops esophageal cancer, and I'd like to talk about those. Let's start with tobacco and alcohol. Squamous cell cancer of the esophagus is strongly associated with tobacco and alcohol use. Studies have shown that avoiding tobacco and alcohol decreases the risk of developing esophageal cancer. Let's also talk about diet. A diet with plenty of green and yellow fruits and vegetables and cruciferous vegetables such as cabbage, broccoli, and cauliflower may lower the risk of developing squamous cell cancer of the esophagus. I should also mention nonsteroidal anti-inflammatory drugs. Some studies have shown that the use of nonsteroidal anti-inflammatory drugs or NSAIDs such as aspirin or ibuprofen are actually associated with a reduced risk of developing both squamous cell cancer and adenocarcinoma of the esophagus. Use of NSAIDs, however, increases the risk of heart attack, heart failure, stroke, bleeding in the stomach, intestines, and kidney damage, so be aware that there are some risk factors associated with taking those drugs as well. Another topic that we should talk about while on the topic of prevention is Helicobacter pylori infection and gastric atrophy. Infection with the Helicobacter pylori bacteria is known to cause inflammation and ulcers in the stomach lining. This may lead to a condition called gastric atrophy. Gastric atrophy occurs when cells that line the stomach are destroyed. This condition may increase the risk of developing squamous cell cancer of the esophagus. If you have heartburn or ulcers, make sure to get checked for H. pylori. And if your test is positive, your doctor will recommend a 2-week course of the antibiotics. Now be sure to take all of the medicine to eradicate this H. pylori bacteria in your stomach. You should also remember the association of gastric reflux and Barrett's esophagus that we talked about earlier, and how these conditions can lead to cancer of the esophagus as well. Gastric reflux, the backing up of stomach contents into the lower section of the esophagus, may irritate the esophagus, and over time, remember, it can lead to Barrett's esophagus. In section 2 of our series on esophageal cancer, we talked all about Barrett's esophagus. So if you haven't done so already, make sure to watch this video. Okay, in a nutshell, be careful about what, how, and when you eat or drink. Get more fruits and green leafy vegetables, limit your consumption of alcohol, and definitely avoid tobacco. I'm Dr. Sugar, and if you haven't already done so, be sure to watch all of the medical inspiration videos on cancer of the esophagus. Thank you for joining us. Check out the video content library for many other medical videos on a wide variety of topics, and I'll see you there.